Hello, this is Dr. Samuel, your online doctor. Okay, now today on this occasion I will talk about the matter of infertility. Okay, of the matter of a couple not being able to get pregnant or achieve a pregnancy. I want to especially address the anxiety that some couples get if it happens that they want to get pregnant and it's not coming and it's not happening. First of all, for a woman to get pregnant within a year, she has to have sexual contact, intercourse with her husband at least 2 to 3 times a week, every week, for 52 weeks, for a year. That's the requirement. If it's less than that, it will take longer to get pregnant, above a year. So sometimes some couples are concerned, but when you interview them, you find out that they're not having sex frequently enough. Sometimes once a week. So if couple is having sex just once a week, it will take longer than a year on average to get pregnant. Some of them could get pregnant even within a month or two. Some of course will get pregnant months later. So it's a distributive situation. There'll be core of people who fall within a mean in average and some outliers. Okay, so that's the first requirement. Are you having sex with your wife or husband frequently enough? That's the first requirement. If that is established, and then after a year there is no conception, then you now have a case of infertility. So what will the causes of infertility? In many societies, one very important cause of infertility is often neglected. That is the male. It's called male factor. It takes a man and a woman to have a baby. About 30% of the cases, the fault is lies with the man. Okay, a man may have a low sperm count or no spermatozoa at all in the semen. Okay, or sometimes a good percentage of the semen are 40 of the spermatozoa are 40. They are maybe immotile, can't move. So a poor sperm quality contributes to infertility. It's because of infertility in 30% of patients, of couples. So that has been ruled out by taking a semen analysis. So if a couple, if you're having difficulty having a baby, is one of the things you have to do is for the husband to go and have a semen analysis done. The doctor will do that for your husband. Then the other 70% of the cause will arise from other factors. Okay, I'll name them now. First, you know that a woman's reproductive system is under control of hormones. That's why a woman bleeds once a month, and there is under control of hormones, which changes in the woman's reproductive system to achieve ovulation and purposeful conception. This hormonal system prepares the womb for conception every month. If conception does not happen, that's why that preparation will break down and be discharged as blood, which is the menstrual flow. So every month, these hormones build up the womb for conception. When it doesn't happen, the process starts afresh. So if this system is faulty, the woman may not ovulate, may not make eggs. Okay, the woman may not make eggs, or if he makes eggs and then conceives, the pregnancy may not last. In the case when the hormone progesterone is too low, the pregnancy may not sustain, because progesterone is necessary for sustaining the early pregnancy. All right, so in these hormones are produced in the brain and in the ovaries. So if there's a fault on this axis from the pituitary, the gland that produces these hormones, or there's a fault with the ovaries, then the woman may not ovulate, and that will cause infertility. Those other one part also, we give a name, it's called ovarian factor. This fault is called ovarian factor. Now, another factor could be for the uterus. The uterus will be faulty. We have fibroids that obstruct the cervix, such that the man's sperm cannot move freely into the uterus. Or fibroids that prevent implantation, because there's no good space. There's no good space for the fertilized egg to take root in plants. So if this is the case, there could be infertility. This is called the uterine factor, a faulty uterus. Then there is cervical factor, the cervix of the host side to the semen of the man. The cervix of the host side may have antibodies, or that destroy the man's semen or spermatozoa. Okay. So, and in lupus, that's systemic lupus erythematosus, there is an antibody. It's called lupus anticoagulant, which can cause abortions, miscarriages in women. So these are some factors that can cause a woman to get pregnant. These things are cause a woman to get pregnant, and so the approach will be about another aspect of the hormonal factor or the way it could manifest with the woman having milk in the breast milk when she's not pregnant. So this is caused by an excess of the hormone prolactin produced by the anterior pituitary in the brain. So that if this prolactin it has a natural effect of contraception. That's why when a woman is breastfeeding, her likelihood of getting pregnant is decreased. When a woman is breastfeeding, her likelihood of getting pregnant is decreased, because sucking the breast causes the release of prolactin, and prolactin will suppress ovulation. It will prevent something called the egg surge, which causes the release of the egg. So the woman cannot. So it's a natural contraception. So if the woman has milk in the breast when she's not pregnant, it could be a sign that there's a problem. So all of this, the way to approach the way to approach further this situation is to investigate these factors in the pregnant, in the woman we have in the couple having difficulty getting pregnant. I've talked about semen analysis for the main factor. For the ovarian factor, we have the necessity to do some hormonal analysis. Each commonly is called a fertility profile, in which the hormone, the stimulating hormone, follicle stimulating hormone, and prolactin are assayed to check the levels. Alright, so then, and this assay is done based on a period, on a specific period, based on the period of the cycle, because the levels vary throughout the menstrual cycle. So now the next thing we'll talk about. So then for the also, I think to mention infections of the pelvis as a cause of infertility. So chronic pelvic inflammatory disease. Chronic PID is a very common cause of, is the commonest cause of infertility in our setting here, in our Nigerian setting. Is the commonest cause of infertility in a woman. Having an infection in the pelvis, the lower abdomen, because it causes the tubes to be blocked. The tubes can be blocked. The tubes can be blocked by having having fluid trapped in them. Clear fluid, if it's clear fluid, it's called a hydrosalpinx. If it's pus, it's called the pyrosalpinx, and it requires surgery to evacuate. Now, so, and also it is carrying the chronic infection can scar the tubes and destroy the cilia that wafts the egg from the ovary to the cavity of the uterus. If you like this is like a rail system, a railway that conducts the egg. If part of this track is damaged, the egg will end up trapped where the damage is and not move further and end up being fertilized inside the tube or before it gets to the cavity of the uterus, and then that will be an ectopic pregnancy. Okay, so you can see that so infection in the pelvis, the lower abdomen of the woman, that lasts a long time. Is the commonest cause of infertility, and the way to get about this, an ultrasound scan could help find things like pus trapped in the tubes, or fluid trapped in the tubes, or clear fluid trapped in the tubes. It could also find an ultrasound scan can also find excessive fluid in the pelvis of the woman, indicating a pelvic infection, the infective process going on. Beyond ultrasound scan, endoscopy passing the lens into the woman's pelvis could also identify adhesions, which are seen as scar tissue in the woman's pelvis, which may have obstructed the tubes. Okay, so usually investigations that can be done to assess chronic pelvic inflammatory disease. Now, so also an ultrasound scan will help identify fibroids in the uterus. Okay, so those are beyond after the assessments, the investigations, and if possibly the cause of the infertility is identified, the treatments can be applied both for the male and for the female. So for ovarian factor, there are drugs that can be given to enhance ovulation. Ovarian factor. For uterine factor, the surgery can be done to remove the fibroids. For infection in the pelvis, a microscopic culture sensitivity will help identify the organism and will help identify the organism and treat it. And then so that's basically it. So if anyone wants to talk with me on any of these things, I'll leave my number in the description box. Thank you very much.